Hello, welcome to Between Two Ellens. I am Ellen Hefner, representative from House District 87.
And I am Ellen Pogmiller, representative for House District 88. And today we are joined by Chris Bernard, who is the CEO of HungerFree Oklahoma. Well, welcome to the podcast.
Thank you.
First, we really just like our guests to kind of talk a little bit about your story, where you came from, and how you got to HungerFree.
Sure. Born and raised in Oklahoma, in Tulsa. At a fairly young age, kind of started being interested in social justice and that sort of thing. I was a white kid who went to school on the north side and had a kind of up and down income levels in my family, so I sort of saw different inequalities, and so ended up going to school in Texas. Continued to do that sort of work there. Right after school, worked for the ACLU, lobbying to legalize needle exchange in Texas. Decided if I am going to do that, I should know the law. So I went to law school in Chicago and worked on wrongful convictions and juvenile justice. So then went to work for a nonprofit doing that work around juvenile incarceration and reducing juvenile incarceration and investing in communities. Went into government to kind of, I always say, put my money where my mouth is and see if I could actually do what I was advocating for. Did that for 5. Mm-hmm. Had my second child with my wife, who's also from Oklahoma. And so we ended up landing back in Tulsa to start HungerFree Oklahoma. And now we have 3 kiddos all in Tulsa, in public schools.
Yes.
Tell us about HungerFree Oklahoma.
So we are founded on the idea that hunger is solvable if you leverage the right resources. The largest pool of resources to address hunger lives in the federal government, right? So about 94% of your food safety net is federal dollars. And we as a state, when we started 10 years ago, we're doing pretty terrible at leveraging those dollars. We're leaving, by our estimate, about $400 million a year on the table that could have easily been drawn down to address the issue. So recognizing that, we are a policy, advocacy, research, and probably more than we intended, also implementation organization focused on that idea. So we work at the federal and state and local level, very much based on collaborative models to make sure everybody who needs access to those programs has access to those programs. That way our charitable dollars go to fill the gaps in those programs rather than to replacing them.
That's that PP, the private.
It's public-private partnership, right? So we have government contracts with tribes, used to with the state, some federal. We work with nonprofits, school districts across the board. How do we all work together to make sure, we all have mission alignment in some way, right? Schools are there to educate kids, but they're also feeding kids. And so how do we work with them? It's all connected in different ways that would take me your whole podcast to explain.
It's complicated.
Mm-hmm.
Yeah, as simple as it is complicated because we've kind of designed it that way, to be honest.
Mm-hmm.
So I would say over the last year, SNAP has been one of those issues that seems to be front and center, both at a state level and at the federal level. So if you can tell, in case our listeners don't know, just a little overview of what SNAP is, why it was designed, and what we've seen in the last year.
Sure. So SNAP is our largest and most impactful anti-hunger program in the country, right? And it's Supplemental Nutrition Assistance Program. So if you meet the income requirements, which is 130% of the poverty line or below, you get a sliding scale of resources to help you purchase groceries from your grocery store. So it's super efficient, one, because we just give you the card, you go get food when you need it, the food you need, right, based on your own family's needs. You spend that money in your local grocery store, so it's stimulating your local economy, helping pay for jobs and other things, and really is the most effective way to get a resource to address this issue in the hands of somebody. So in Oklahoma, I'll give you a little historical perspective. When we started, we talked about leaving money on the table. Our SNAP participation rate was about 82%, which means 82% of eligible people were accessing the benefit.
That's good.
It's not bad. It's not 100%, right? So in 9 years, so we celebrated last year, that participation rate was up to 98%.
Wow.
Right.
So that's good.
That's great. And then HR 1 passed, so the big beautiful bill at the federal level, which fundamentally changed SNAP in several different ways. First, it made a whole list of folks subject to what is branded as work requirements. For those who are in favor of them, we refer to them as time limits, because what it really says is you can only be unemployed for 3 months and get this benefit in a 36-month period, and then we're going to kick you off. So that became veterans, homeless folks, kids aging out of foster care, parents of kids who are 14 and over, which was historical. You've never had anybody with child dependence subject to that requirement before. And seniors, instead of at 55, it now goes up to 65. So by our estimates, it was around 40,000 people that would impact. I think that was actually a low estimate.
40,000 in Oklahoma?
In Oklahoma alone.
Okay.
And to give you a perspective of what that means, like, until recently, we had about 700,000 people on SNAP in any given month in Oklahoma.
Wow.
And so that's about, in dollars, over $1 billion a year coming in to help us address hunger.
Wow.
Right? So in addition to that, it impacted a few lists of refugees who were eligible for SNAP who no longer are. That number was super small in the grand scheme of things. But then it shifted priorities for states. So it shifted costs. It said SNAP has traditionally been a 50-50 administrative model. So state puts in $1, feds put in $1. That's how you run the program.
Love it.
Exactly.
Matching funds, love it.
So now it's 75-25. So every $3 state puts in, feds put in $1.
Wow.
So that's one new cost impact,
That's
right?
huge.
For the state of Oklahoma, we estimated 30 million. I believe DHS asked you guys for about 25.5 million to cover that. In addition to that, there was an unprecedented benefit cost share provision put in that said states will be subject to cover a certain percentage of the total benefits in their state based on their error rates. So error rates are over or under payments of SNAP benefits to households. So
I think you have to repeat that part because people
Don't understand.
Don't,
So,
but
Under.
Let's talk
Yeah.
about it. Over or under
Oh, under.
payments.
Yeah.
They are not fraud. On the USDA's website, you can go look it up. It says innocent mistakes made by the individual or by the agency.
That's right.
Right? So maybe you don't calculate certain write-offs that you get credits, or maybe you don't report the housing costs appropriately based on certain breakdowns. Maybe you're splitting households within a house, but they decide you shouldn't be because you only have one refrigerator,
Yeah.
right? Those sorts of things. So, based on your error rate, you are subject to certain penalties. So, Oklahoma and most other states had an error rate above 10%. About half of the other states had it at 10%. That would make you subject to a 15% cost share of benefits, which frankly is an arbitrary number because they were doing a math problem to balance the budget. But for us, that would mean $250 million annually, right? Between 8 and 10%, you go to 10% cost share, so about $180 million, 170, and then between 6 and 8, you go down to 5%, so 90 to 75 million, depending on if you listen to us or DHS. Our numbers were a little different. And if you're below 6%, zero. A lot of states have been below 6% or close to it pre-COVID, and we shifted our priorities, if you will. The Biden administration said, and the Trump administration at the beginning, we want to make sure people who need benefits get them, right?
Right.
So focus on timeliness, meet their needs right away, and then work on some of the other paperwork and confirmation. Like, you still had to show a social security card, you had to prove your income, all those things before you ever got a benefit.
Yep.
But then some other supplemental paperwork, maybe you could wait until recertification or something. So that shifted the way states operated, and so your error rates went up a little bit, but people got their benefits in a timely manner, which before COVID had been a huge problem, right? We were close to getting fined by the federal government for how long it was taking us. So I think of it as like a scale, right? And the scales got tipped a little bit this way. And HR1 took it and basically broke the scale. And it's all the way this way, just about accuracy, but in kind of a perverted way. So error rates, I told you, are mistakes, slight overpayments, underpayments. Not counted in error rates are those who qualify for benefits and you just reject them. That there's no penalty there, there's no problem.
You just reject them.
Yeah. Now, you're not going to design a system that purposely does that because that has all sorts of implications. But what you are going to do is you're going to put a bunch of new requirements in place on the front end, like new verification processes, additional paperwork, in-person visits to the office, those sorts of things. Each one of those is a barrier that, like, anyone who works in this field knows, you have a drop-off at every barrier, right? Like, people just give up. They can't find it. Their circumstances change. Transportation isn't reliable. The phone call, DHS calls them back. They don't get it because it doesn't identify correctly. You're going to have way longer delays and people just get fed up. We right now are getting daily reports from people of waiting 8 hours or more on hold.
259 minutes to an agency.
Yeah. So you have those challenges. You then have people who are frankly also scared because you have this immigration discussion inside, and the governor signed that new order. So if you have a mixed immigration household, you're probably also going to decide to pull out, right? Like, so you have all these factors, but the states are now totally incentivized to create lots of barriers that they're not going to call barriers, right? They're going to call, like, we're focused on accuracy, that cause your numbers to drop.
Yeah.
Right. So from the time HR1 passed to now, we have lost 15% of our SNAP caseload. And that's, you haven't had incomes change, right? These people are no longer qualified in the sense that they don't need it. They either gave up, they don't qualify because they don't meet that time limit rule anymore, right? Because maybe they're an hourly worker and they're not meeting 20 hours a week because that's what you have to meet. Or maybe they lost their job and couldn't find one for longer than 3 months, whatever it is. And so that equals 100,000 people. So we went from 700,000 people to 600,000 people. What that equals per month in terms of dollars is about 19 million, because your average SNAP benefit is about $190 per person. So you annualize that, right? And you get to like 240 million, about 228, I guess, if I do the math correctly. The budget of both food banks in the state of Oklahoma plus my organization is less than 228 million annually, right? And the numbers haven't stopped going down. Like, it has been a steady trickle. A month and a half ago, or 2 months ago, it was at 10% drop. Now we're at 15. With food prices going up and other costs going up, right? And before HR1, every nonprofit in the state that focused on food would tell you they were at record numbers of demand and revenue. Like, and at some point, we're going to hit a threshold where we have to, like, there's no more to get, right? And so the state of SNAP is super concerning for us. I think what you're seeing across the country and seeing here is states are then cutting costs preemptively to get ready for this. And in some cases, they're cutting it in places that are actually going to make this problem worse. Whether that's in SNAP outreach, whether that's in your processing centers that help process cases, staff, whatever it is. There's going to be huge challenges there, and it's going to continue to create pressures on our external systems, but also on the internal system. It's almost like a self-fulfilling prophecy, policy, whatever you want to say. But it's also, frankly, your colleagues, if our error rate goes under 6%, are going to see it all as positive, right? And I think that's the challenge. So how do we tell a story that, and the federal government's celebrating it, and they're saying it's because they stopped fraud, which is, one, not true, two, they've provided no data for, and three, frankly, some of the representatives of this administration are just flat out lying on national TV about how the programs work in the first place, right? But I think that's the challenge in the state of SNAP, the challenge for those of us who focus on it every day, right, is how do we tell a story that's pretty complicated, it just took me 20 minutes to explain to you, to the general public and say, this is not, right? If I told you, well, this soup kitchen used to serve 100 people, But now they only serve 85 because they decided those 15 people sitting across the street shouldn't get food. Isn't it great? They've dropped their caseload. You would say that is horrible,
Right.
Yeah.
right? But that's exactly what happened with SNAP.
It's a story we tell.
Yeah.
It's a story we tell.
When I think so, I met you when I was at the Regional Food Bank of Oklahoma and, fully support the work of emergency food banks. And emergency is really when, it hits the fan and families need food that day.
Yep.
And they're traveling around to find what food pantry is available, where can they access food. And that could either look like a box or if they're lucky, maybe client choice, but still very limited and may not necessarily reflect the food that their family eats at home.
Correct.
And after 5 years, while I loved the food bank, I knew that the priority should be to focus on SNAP because it's a family economic stability that ensures that people have access to the foods that they need. And twofold, it actually supports the community with those dollars.
Yeah. Yeah, charity is crisis response and it's needed, right?
Yeah.
Like you are in crisis. You don't have time to fill out these 5 papers
Right.
and give me all of your stuff. I'm going to give you this food immediately so we can get you on a sustainable track. The sustainable track is the federal assistance. It's SNAP, it's WIC, it's school meals, right? It's summer EBT, which we can talk about too. And like that, I think people hear that and they're like, well, I don't want people on that stuff forever. Like the fact is, like you look at studies, a child who grows up with SNAP compared to a kid who qualified for SNAP and didn't get SNAP, the kid who didn't get SNAP is more likely to be on SNAP as an adult than the kid who did, right? Like because those resources help you get educated, they help you move on in life and thrive, right? And so there's that investment. But yes, whenever people hear me say 94% is federal, 6% is charitable, that is not putting down charity. Charity is never going to be the point of government is to pool resources to solve really big problems. Charity can solve local, very acute issues, right? And they need to work together to do it. And historically, and what we're moving back to is the federal government not playing its role and pushing it back onto charity that they're not going to be able to handle.
I love it that you brought up application because serving with, in the chamber, and I always want to know, so like, who's ever filled out an application for Medicaid?
Yeah.
Okay, then maybe you should try that.
Yeah.
And then maybe why don't you pick up the phone or SNAP? Maybe try to pick up the phone and see maybe if my English isn't the best, but I am a citizen.
Yeah.
Then try to ask someone those questions because it's usually not
No.
translated, or you get someone that's an
Or
interpreter.
you have to wait 2 hours for an
You have to wait 2 hours. And so when we talk about fraud and abuse, because I hear this a lot with Medicaid, there's no, which is great. State-funded, state-matched dollars are great.
Yeah.
We're giving and they're matching, and that shows that there's an investment on both sides.
Sure.
For me, waivers, I'm talking about waivers. But with this also, it's that people have no understanding. The applications are very intrusive, and they don't make you do it just once. Like if you have a disability or, checking in to see if you got to do it again. And then sometimes they change things.
Yeah.
Or now with workforce, it's less. Or it's confusing and sometimes you get dropped.
Yeah.
And it's during working hours. We want people to work. So from 9 to 5,
Yeah.
and they're not open on the weekends. I heard 9 to 4 now. So when are you going to call if you want to have a job? Could you speak a little bit about what you do for people
Sure.
with those applications? Because it sounds small, but it's not.
No.
It's not. It's it's a big piece, and it's one that you have to keep doing.
Yeah. So until July 1, we have state funding to do this work. After July 1, we will continue to do this work fully privately funded with less capacity. But we helped the state write a SNAP outreach plan, and we run a hotline that folks can call into, and we do full application assistance. We sit with them and walk them through the application, and can actually submit it on their behalf as proxies. That for us was, I think, 10,000 this year, or fiscal year, state fiscal year is how we count it, that we had helped. During COVID, it was profoundly more than that, but we've kind of found this balance
That's a
of
lot.
it's a lot, and it meets a very specific kind of population, the ones who are going to be discouraged otherwise. So it's a lot of seniors right? We have Zomi and Spanish speaking hotline agents who can help people. We translate all the materials into those because DHS doesn't always do that in a timely manner, and some of that's
And
a
there are time
resource
limits
problem.
too on this, right?
There is 30 days you have to approve or process,
Yep.
approve or deny. So we do that, but we also train a network of 400 partners how to do that. And we have a learning management system. They can log on to online classes and do it, and then we serve as kind of their triage. If they're having problems, they can call our staff and we work through it. In our view, that's been operating for 6 years now. That's a huge part of why you saw the participation rate
Of course.
raise up, as is what DHS has done. They put a lot of
Yeah.
effort into that, right? So we do that for SNAP. We also do that for summer EBT because we work with 4 tribes to run summer EBT. And honestly, our vision for that and what we know works, because some other organizations do that, is like we'd hope to have the funding one day to be able to do that across every application program in the government, right? And buzzword, you hear this nonstop in the chamber, I'm sure, but nationally it's always been talked about, and everyone talks about it, is we need a universal application. You need one application that fills out others.
We tried it a couple times.
And usually you'll be told we're working on it, right? Like we're always working on it. I think that's been what has been said for 10 years since we've been around. We've tried to come up with a private fix, and that's frankly hard too, because I can build a skin that goes over an app. Like this is what you see, but in the background it's filling out 9 applications. But every agency changes their application so often that it breaks the system every time you do that. And if you don't know ahead of time that that's coming, like then your system's down. So that breaks down trust with the public when that happens, right? Because they think you can't help them.
Agencies silo themselves from that too.
Yeah, but we've designed the system that
Yeah.
way, right? Instead of like 3 anti-poverty programs that support people in a simple way and give them resources they need, federally we have like 40, right? And you have to fill an application out for each one to prove you deserve that one, but you're not going to deserve this one, and it all creates the bureaucracy and red tape that we claim to hate. So
Yes.
it's challenging.
It's challenging.
Very
But thank you for explaining that too.
Yeah.
Yeah.
Because I think people don't think that it's as complicated as
No,
it is.
it's a huge piece,
And that's the
right?
first step.
That's the first step. I mean, it's like doing your taxes. You have to figure out a lot. And then when you talk about the various exemptions or like credits you can get for, whether it's your housing cost or your energy costs, or for seniors, it might be medications and medical. Like that's all super confusing. And there are federal waivers you can get to simplify that for seniors, for instance, that we as a state have not done yet.
I ran a bill on that with Bill.
Yeah. And I think generally it's ridiculous as a premise that an organization like mine has to exist to be like this go-between between government and the public and figure out how to make systems work for people instead of work against people. And yet, like, I'm pretty confident I'm going to be needed for quite a long time, right? Because you have these counter purposes and counter arguments that like end up driving the problems that we then have to fix.
In my office, I do a lot of one-offs, which
Yeah.
means that there's a problem.
Yeah.
If they have to, because they know me or know that I, know who to talk to on the DHS or DDS side, that one-offs, and it's like, why are we doing one-offs? Because that person was the only one that knew me. There's many more that I don't know that have given up. Probably.
Yeah. And we would get them on the, like, I always tell this story. It was during the height of COVID, right? But we had convinced private funders we launched a hotline in a month with all private funding. Like we raised $350,000 in about 2 days and then moved it and then showed it to government and got them to pay for it. But we had a hotline agent who was dealing with a senior, just a wife and husband. And, she was very frantic when she called, and our agent walked her through the process, filled out the application like several times, had to kind of calm her down, and submitted the application. And it was an older lady. She didn't realize she hadn't hung her phone up yet. And so she was talking to her husband. The agent was like, ma'am, you're still on the phone. She said to her husband, like, thank God we got that done. I was ready to just end it, right? And not end it like be done with the application, like end it all, right? And like that's the level of desperation you're talking about with people trying to access
hungry.
these.
Of course.
Yeah.
Yeah, of course.
And you feel like nobody cares.
Yeah.
Right? Which is also what we're hearing from, like, we have a cohort of lived experts we work with and work with them to tell their stories and be advocates. And it's starting to build a pretty big network. But, like, that's what we hear all the time is it feels like no one cares. Like, we're abandoned and we're just, like, if nothing else, we're the target. Right? And that is defeating, like, as a human being.
Mm-hmm.
And, you know, we talk about being a hope-centered model in Oklahoma. Like, we are stamping out hope on the regular with the systems we built.
So one of the things you've mentioned a little bit, and now that we're in summer, is, you know, one of the hardest times I can say on families is summertime, because for many public schools is your breakfast and lunch, you know, and maybe you eat at home, or maybe you have an after school program that provides additional snacks or dinner. But so tell us a little bit about summer feeding in our state, and then, you know, summer SNAP that is an option too for some.
Sure. Okay, so let's do summer feeding first because it's pretty easy. Again, when we started, we were worse than the nation at summer meals. There were many reasons we can argue about for that. Some was the department didn't promote the program. It's administered by the State Department of Education. Some were vendors or sponsors like food banks and others were not talking to each other and sharing data and thinking about how to best serve the whole state. Some was funders didn't know about it, people didn't know about it. But it's primarily funded by the federal government, and then food banks use some private donations to kind of supplement labor costs. So any kid who lives in any eligible area, which is like 98% of Oklahoma, is eligible because of poverty rates, can access a free meal at a summer meal site. If you're in rural now, thanks to a lot of advocacy, frankly, like we push really hard, as did a lot of other advocates, since COVID, you can pick up more than one meal. You can get like a whole week's worth of meals at once in rural communities that are approved. But if you're not in one of those, you have to go sit there and eat it at the site, which is not the best model. Anyway, you can access those whenever available and get a free meal or a free week's worth of meals. You can go to meals, the number for OK, or mealsforkidsok.org. I never get that website correct. And we built with some coders like a map where you can put in your zip code and it'll give you the locations near you. It will give you the meal times they have, whether it's an open site or closed site, because some like camps for kids with special needs or something else might be a closed site. And you can go access your meals there. So we want everyone talking about it. Every elected official should know that website. They should be pushing it to their people. But we've had huge improvement as a state, particularly since that rural option has been added. Like every sponsor's numbers are going up every year. The state, in the name of, again, kind of regulating and under the direction of the feds for like sort of program efficacy, limits how much you can expand essentially as an individual sponsor. And so growth can only come so much each year because they just won't let you put another 100 sites out there. And they have some rules written and some rules unwritten about how close those sites can be to each other and all these interesting things. So,
which is very problematic in a very rural state like ours.
It is,
like,
yes.
That just is mind-boggling when you think about kids trying to access food and many are on their feet.
Yeah.
You know?
Like, no, transportation's a huge piece of this, right?
Yeah.
As is practicality, just of like, in some neighborhoods, you're not going to let your kid outside, right? Like, you don't want them walking 3/4 of a mile to a meal site. And so it is an imperfect system. And so another response to that, that again had been advocated for forever, but in COVID we got it temporary and post-COVID made it permanent, is summer EBT. So you called it summer SNAP, right? It is a benefit that gives you dollars on a card that can only go towards food. In most states, it functions exactly like SNAP. It doesn't here because our state does not run it. We have rejected it 3 summers in a row now because of costs. And then, you know, there was some political language the first time we rejected it. But when the governor first rejected it, just so happened to coincide with the time the Intertribal Council was meeting. So I went to the Intertribal Council and said, you are authorized to run these programs. And actually, Cherokee and Chickasaw Nation had run them at a smaller scale for years as pilots because tribes were authorized to run it as pilots. And it was the evidence we used to advocate for it nationwide. And said, would you consider expanding this? And, Muskogee Reservation was the biggest population center on a reservation not being served. Could you work together to do it? I was not asking to be involved. And to me, it's a story I now tell about leadership because, like, you were in Leadership Oklahoma. I was in Leadership Oklahoma. I got to tell this story one time there.
What class were you?
I was 35. Yes. Yeah. A couple years before you.
Yeah.
But I'm sitting in front of Governor Anatubby and the 4 chiefs and gave this whole speech about, like, this is going to cost you money, but it'll benefit lots of kids. They're not your members. And the governor stopped me. He said, so I just want to make sure I understand. He was like, you're not asking for a contract. And I said, no, sir. He said, you're not asking for any money. I was like, not for me, but I'm asking you to spend some money to bring in more money. And he was like, you just want us to feed kids? And I was like, yes, please. And immediately, yes, like all 5, right? So it was very powerful, and it was the most nerve-wracking thing I've done in a government relations career that's been like 18 years long. But it was amazing, right? So then you get moving, all these tribes working together, and we serve all of Muskogee Reservation together. They ended up asking us to help administer it. So we run the data, we run a hotline for them, we process all the applications, we cross-check to make sure no one's getting double benefits. And we work with school districts to get the data to auto-qualify kids. So you just get it in the mail if you're on free and reduced lunch. So the first year was Muskogee Reservation, all of Chickasaw, as well as Seminole, Choctaw, and Cherokee. It worked so well, we talked Chickasaw, and we raised $1 million to pay half their administrative costs the first year. That was the deal. And then they pay for it from now on. So, Tulsa's a high philanthropic community. We raised $1 million in about 24 hours to do that. So came back, said, let's do that in Oklahoma City if the USDA will approve it. It's not on reservation land, but tribal WIC clinics operate here. You have a good argument. And so Chickasaw Nation said, yes, we offered the same deal. We'll raise $1 million to cover administrative costs for 1 year. Will you do it the next years? And they said, yes. USDA dragged their feet, but eventually approved it. Took a little longer to raise $1 million here, but we did. Very grateful to all of our funders, who I will not list all of them, but you can go to our website and see them. Our Knoll Foundation was the largest donor, and we're very grateful to them, as well as Inasmuch, Kirkpatrick, lots of folks. So we do that again, serve another 100,000. So we, this summer, estimate the tribes in total, Choctaw Nation's running it independently. We're working with Muskogee, Chickasaw, Cherokee, and Otoe, Missouri will serve 375,000 kids out of the 450,000 that are eligible in the state.
Wow.
But those 75,000 kids all live in western Oklahoma and don't get access to this benefit. And so we worked with Urban Institute. They showed we were a natural experiment. So they could show the first year families in Tulsa who got the benefit reported healthier eating habits, less food insecurity than the families in Oklahoma City. Then we brought it to Oklahoma City. We haven't done a follow-up study, but you could show the same thing, right? And so there was a bill, again, in the legislature for the state to run it, but I believe did not have funding. It had a revolving fund.
Correct.
In the end, it didn't pass anyway. I frankly don't know any private funder who would put money in that revolving fund. I think the state needs to pay for it, but there's a return on investment. So that's $50 million.
That
It's
was $50 million.
It would be $50 million coming into the
For
state
feeding
kids.
Feeding kids that need food.
All federal money.
Hungry kids.
Yes, and the total cost to the state, our estimate is $5 million. Maybe you have some initial cost of building a system, so maybe it's $10 million your first year.
$10 million.
So the tribes, we don't know. The tribes have their own budgets. I don't know exactly how much they spend, but if you do the math, they're serving 350,000, so they're bringing in about $35 million, right? And that's being spent in local grocery stores and communities. Now it's a WIC model, so it's a food package rather than running like SNAP, and so Some families may not want everything on that package. Some families may love it, but we're seeing big impacts with it.
It's food.
It is food.
It's food.
And it's, I mean, again, like I can tell you, like Restore OKC's store here in Oklahoma City, Oasis, in Tulsa, like those community-driven stores have figured out how to serve those shoppers in a way that word of mouth gets out because they make it respectable and they make it easy to use. And so, like, they gain customers and you're stimulating local economies. Like, it's a big impact that to us was just such a simple policy decision that we were frankly caught a little off guard when the state didn't run it.
So if somebody is listening to the podcast and they're like, man, I definitely need to be a better advocate. You know, maybe they didn't understand, you know, the changes that were happening and really that advocating at the local level, at the state level will make a huge difference too in funding these issues and supporting these programs. How would you get them involved in policy and advocacy?
Well, you can go to our website, HungerFreeOklahoma.org, and we have all sorts of resources for you to learn about things. We also have a newsletter where you can get engaged and where we are building out our software now to do kind of action alerts. But also you can do it very simply, right? So like we talked about summer meals and summer EBT, but SNAP participation rates drive those numbers, right? So if you have more kids on SNAP in your school district or Medicaid, that is the percentage count that the federal government uses to decide whether your school's eligible to feed every kid for free, right? So you could just ask like your local school board member or superintendent, like, are we using the community eligibility provision, which is the technical term for that? And if not, why not, right? And you can go to our website and you can see data of whether your district qualifies or not. You can talk to your local legislator and say, like, why don't we have summer EBT? I want to see that bill. You can talk to them about what's happening with SNAP and why are people, you know, talk to your neighbors. Like, guaranteed you know someone who qualifies for SNAP and you may not realize it. Or, like, if you bring it up, like, somebody who's experienced will talk about it. Say, I know someone who gave up because they waited 16 hours or 3 days or whatever it is. 4 hours even. Like, it doesn't. But I think the most important thing is, like, just think critically about what you hear and then ask questions because then you're going to learn, right? And then you'll know what to advocate. I think the biggest challenge we have right now as advocates, both in your building in DC and with the general public, is everyone listens to the one line they've heard the most. And frankly, like, I'm not the best at one-liners. I talk quite a bit because these things are complicated. But like the one line you hear is fraud. The one line you hear is people are just lazy. The governor's been using the line, we want these things to be a trampoline and not a hammock, right? Which, like, ironically, a trampoline is actually a great description of the challenges people in poverty have because they're up and down, up and down, up and down. I don't think that's what he meant to do, but that they don't think to ask the next question. So, like, we dropped $100,000 in SNAP. And I'm, like, very proud of this. And my father-in-law is super conservative. Always has been. We've always had lots of fun political debates. He read a press release that a certain very conservative think tank put out here in Oklahoma that pointed to the fact that our SNAP rates were higher than our neighboring Mississippi and Alabama states, even though our poverty rate was less than the number of people on SNAP. Didn't mention that, you know, you don't have to be in poverty to qualify for SNAP.
That's right.
But they called on a fraud investigation for it, and they referenced the 98% SNAP participation rate I told you guys about that we were celebrating. And my father-in-law, who, again, super conservative, was like, I read that and I thought about 98%. He was like, to me, that means they're doing their job. They're reaching everybody who needs it. I was like, yes, thank you. But if he hadn't had me telling him that for the last 10 years, right, that wouldn't have been what he thought.
Yeah.
And so the more you can just ask questions, look at another source, talk to somebody who has a different experience than you, it's going to inform your opinion better, and then you can advocate better. But the simplest thing, I think, is just look at who has the power to do something and ask them, are we doing this? And if not, why?
This is that thing that you hear a lot about, you know, well, your churches can take care of it, or your charities can take care of it, which is not sustainable.
No.
Because those churches will not get the same donations every year, and they may have someone who runs the program really great, and then can't do it anymore.
Yeah.
So there's never a sustainability. But as public servants and as our state and government should do, they should step in and go, oh gosh, when someone has a hardship or their husband dies or they don't have enough support with education or a car or whatever, that we step in, that sustainable piece.
Yeah.
And no one really wants to stay there. 134% of that's you're not living your best life.
No.
So taking away that sustainability, and I thank goodness for churches and thanks goodness for charities, but they can't do it all.
Well, no, it's a matter of we want people working, but our pantries are only open 1 to 2 hours a week, right? Because the volunteers can do that. Like, that's not anything that says charity can solve this, I think, is a system that is destined to break, right? And we should, yes, you should donate to your local nonprofit, to your church, everything.
Of course, they do
but also,
great things.
you put money into your government, expect something back, right? Like none of us seem to have problems with insurance, but like every one of these programs is an insurance program. I pay taxes knowing that if I fall in hard times, I can access SNAP that will help support me, right? Or Medicaid or WIC, whatever it is. Like we pay into a system to know there's a net there to catch us, right? And I think what we're seeing with our safety net, like for a while I had a really terrible visual I used in slideshows that I created myself that was like a spider web and I called it a net, but like here's WIC, here's SNAP, here's Medicaid, whatever, and we're just pulling strands, and like then that people falling through the safety net is because we've literally just pulled the strands out of it. It's not a net anymore, it's a series of ropes that hopefully you catch one, right? And that's much harder.
The need hasn't gone away.
No.
The need hasn't
It's getting worse.
It's getting worse. Gosh, it's a lot. Well, this was not a lot.
I'm known for being, uplifting in everything I do.
Well, I think that the positive is that you're still doing the work. The other positive is that, we don't do a bad job at talking to others and trying to tell those stories.
Yeah.
I know that it can happen in the chamber because, disability has been supported a bit more, but we have to keep educating because people don't know those stories if it doesn't really happen to them.
Well, and I mean, really until last year, honestly, like we would go to national things and say in Oklahoma, we're doing this, and other states wanted to learn from us, right? Like we were doing really good things. We still had some challenges. There were still problems.
Of course.
We were working our way up, and like, frankly, HR1 just set up like a dismantling of certain systems and some really big challenges.
And I think low-income states like Oklahoma are going to be much more, impacted at a greater level than other states. And so, that's my fear is that like a state like ours that has always been overly funded by federal government to prop us up, and we still are low income, are going to just see even more negative impacts at the end of all of this.
Well, and I talked about balancing it. Any federal bill has to be balanced. That shows it's going to have zero impact. Part of the calculation of the balance of HR1 was assuming multiple states in the country would stop running SNAP altogether. So the federal government would save money because they wouldn't pay for those benefits.
Well, there's a colleague that we work with, and education was a big topic of last year's session, but hungry kids can't learn. So
that is true.
We can't really try to fix this third grade reading or fourth grade reading if we don't take care of and make sure that mommies are healthy, that mommies get enough to eat, and that those babies are growing with food as well.
Yeah. Well, and if your parents trying to figure out how they're going to feed you, right? They're not trying to figure out how to help you with your homework. Like it's all a part of it.
It's all a part of it. But I'm hopeful.
Yes.
It can be changed. You did it once, we can still there.
Absolutely. There's opportunity.
Yeah.
Yes.
Well, thank you so much for joining us today.
Yeah.
As you may know, we end all of our podcasts with a question. So.
Okay. I'm bad at thinking these things, so I have one that I have my own answer to, so hopefully your answers are interesting.
Yeah.
So the name of your first stuffed animal and why?
Ooh.
Oh, I know it. So go ahead if you want.
Well, I know my first, Paris Junior College was in my hometown, and one of my best friend's dad worked at PJC, and we went to this event for some reason there, and my name got drawn for this big teddy bear. And if you can imagine, I'm tiny as a 4-year-old. So I don't know if this was my first, but
It's
anyway.
the one you remember.
I remember the most. It was vivid that I won this big stuffed teddy bear that was bigger than I am, and I named it PJ for PJC, Pierce Junior College.
Okay.
Oh,
So,
that's cute.
PJ the bear.
There's a relative that were Catholic, and it was a uncle it was a cousin, second cousin that was a priest, lived in California, came back and gave us all stuffed animals. There's 5 of us. Mine was this blue dog. And I was like, oh my gosh, it already comes with a name. Rufus, R-U-F-U-S, but that was the name of the company.
Oh.
But I was an early reader, so I guess that was just.
There you go.
And I was like, oh, it came with a name. It was almost like the early Cabbage Patch Dolls.
Yeah.
That they came with names,
Yeah.
Now I thought these little stuffed animals came with names, but I slept with that thing all the time.
Yeah.
Well, how about you? Do you have
So
a stuffed
mine,
animal?
my favorite movie as a kid was the cartoon Robin Hood from Disney.
Oh,
So
yeah.
So I had a fox, a raccoon, and a bear, and it was Robin Hood, Friar Tuck, and Little John.
Oh, I love that. What a great story.
And
What a
here
great
you
story.
are doing the work of
That's
Robin.
right.
You
That's
know,
right.
I love it.
I love it. Look at full circle there. Well, thank you for joining us. This was such a great topic. And if you have any questions, or what's the website?
We'll put this in the notes too, but mealsforkidsok.org.
Yep.
And we're always interested in help educating. So please reach out with questions or how you can help.
Thank you.
Thanks for joining us.
Bye.
Thanks.